well.
I have his arm shaking. I was like,
Relax. Okay. So,
Just preparing the
you got nothing.
a little tiny millimeter. So it's firm abnormal capsular end field. Okay. Now I'm going to do a distraction. Relax. It's hard to relax, isn't it?
Mm-hmm. God.
Painful? Yeah.
You didn't do
The
the
distraction was
one.
painful.
Oh, one. I was just gonna take it.
hey.
Distraction, yep. Trying to separate the joint surfaces. Yep.
So,
Yep.
Start thinking, is this joint or muscle?
This
What
is
did she
joint.
have? She got an S curve, so, and the joint's tight. So it's going to be. It could be both sides.
I was gonna say.
it's not going anywhere.
He's moving and there's no joint movement. Even though
Very
it's
stiff.
flat.
Cool, use your fingers.
That one didn't hurt. That one.
Okay, so active, passive, resisted, just did mobility testing.
She did.
5 minutes each. He's exhaling to relax, okay? So just notice his posture. Where's his head in space? Is it tilted to the right, tilted to the left? Is it rotated?
Tilted to the left.
Like this.
Slightly shifted to the left.
Like this. Yes. Tilted
So to the right.
Oh, to the right.
His right, our left.
Yes.
Okay?
He doesn't blink.
And he's a little rotated. Okay? He's a robot, right? Okay? So that's just an observation for him. So now go ahead and open your mouth as far as you can and close. And open as far as you can and close. Okay? You don't see anything. And it's very fast closing, isn't it? Okay? So as he does it, a few more repetitions, he starts to develop a deviation.
Oh yeah, I see it.
To the left. You see it?
Yeah.
Do it again. I'm trying to hide it.
Wait, I can't see.
No, because it was the same with Julia. She was looking at it, and then as we did it a few
Open your
times,
mouth.
like, oh, and she said, there it is. It's a seat.
I see the hitch, but not the.
Right? So sometimes it takes a few repetitions before you see the real pattern that's happening. Okay?
I got my glasses on.
I don't see. Wait, is it to the left or is it to
To
the
the
right?
left.
Are you sure that's not his hair though? Because on the way back up.
His jaw's
Okay.
Yeah.
If you are not facing him,
Oh, dude.
if you're not facing him, you will not see it. Right? If you're on the left side trying to observe it, it's going to look normal because it's going towards you.
Oh.
Stable hand.
Oh, nice and well. Nice and
See it?
thank you and close.
Good.
There it is.
And open
Good. Morning.
and close.
It's like very slight,
It's
subtle.
very slight, it's soft, right?
I'll say it on the
So
video.
you do. So when we did his overpressure, so we did teeth slightly separated. Move your jaw to the left. Okay. And do overpressure. Relax. I'm going to take it a little further. Okay. Okay. And now come this towards me. There you go.
It's more lip.
It's really stiff coming to the right. Okay.
Jaw.
And he really tries to move it with his facial muscles. You see that? His lip really tries to move that. So it's just an observation. We don't know what's going on yet. He doesn't have any jaw pain, do you? No. Right, so it's just him, but it's a good example to use. So next thing we're gonna do, we did active passive, right? So you can do passive retrusion, okay? So move your jaw back for me, okay? And relax. I'm gonna take it a little further. So I'm just doing retrusion, okay? If I wanted to do protrusion, I'd have to be back here and pull. So move your jaw forward, and then I would do a little pressure there.
Hook 'em.
Okay? You just hook behind the mandible to push it forward. Okay? So we're gonna do resisted testing, supine.
Oh, me?
Yep. Oh no, we need Nicole. We need Nicole.
Yes.
You were just an example. Nicole. And then we're gonna pick on John.
Cole's more messed up than I am.
Thanks, Alan. Appreciate you.
Don't pick me. Don't hit him with your bun, bro.
Don't be jealous.
So neutral position, just relax. Okay, so now we are going to do isometric resisted testing. Okay? Right, so she is going to just open her jaw a little bit. I'm going to try and push your jaw up. You're going to resist me. Don't overpower me. Okay, so hold it right there. Hold it. Hold it. Hold it. And slowly relax. Any pain with that?
No.
Okay, good.
Fight through steel.
So she was trying to do mouth opening. I was doing closing. Right. So open your mouth a little bit. So I can come this way. I can do mouth. We'll try it. Yep. Hold it there. Don't let me move you. Hold it. Hold it. Hold it.
If you wear
And
gloves,
slowly relax.
do therapists also just hook the bottom of the jaw? No, right? Too much pressure
It's
on
too
the
much.
teeth?
Yeah, too much power. Okay. Now I'm gonna do, open your mouth a little bit. I'm gonna try and pull your chin to the right. You're gonna, nope, you relax. Okay. So I'm trying to pull her that way, stabilizing her head, and hold it, hold it, hold it, and slowly relax. You can come in this way with one finger. Okay, hold it here, hold it, hold it. And slowly relax.
For
Any
better
pain
amount
with
of
that?
power.
Okay. Hold it here. Don't move you. Hold it. Hold it. Hold it. And relax. She really struggles to hold it to the right. Do you guys see that? So open up a little bit.
Is that why you change your fingers?
Hold it. See her struggling just,
Yeah.
and that's just with one finger to hold it. Okay? I'm trying to, yep, I'm trying to push her this way, she's pushing that way. Okay, and the same thing for this way. Okay, like a gross motor. Relax. Hold it. Don't let me move you. Hold it. Hold it. Okay, so on this side, she has much more control than going this way. Hold it here. Hold it. Don't let me move you. Hold it. Hold it. Right, so she has trouble just holding that position. Okay. Let's see. Mouth opening, mouth closing. Excursion. You can do protrusion. There you go. Hold it there. Don't push it down. Hold it. And slowly relax. Okay. And we don't do resisted for protrusion.
Cool, that's not like uncomfortable.
That one,
Doesn't hurt.
that one's the only one that
The
actually like
pressure
hurt like right
behind the ear. Yeah.
Does that have to do with like how you said like there's like a working side?
Yeah, so remember we're just doing resisted testing, so we're just trying to, if there's a muscle issue, we're looking for either strength or power, right? Or reproduction of symptoms, okay? So when she was trying to move her jaw to the right, she had trouble controlling it. When she moves to the left, she has more control, okay? We also notice in standing, what does she have? An S deviation, right? So what's the next step? Active, passive, resisted. Active, passive, resisted.
More pressure.
Active, passive, resisted.
Joint lobes?
Yes, mobility
Yeah.
testing.
Oh, sorry.
You should all be in sequence. Active, passive, resisted mobility.
Yes.
So general feedback on your physical exam findings on the crafty.
Correct.
That's what should have all been listed. Active, passive, resisted mobility, special test, neuro, whatever it is, palpation, right? That's what I'm gonna do. The next section was, what was your expected findings? Then you're gonna go pick off that list and say, what were your expected findings, okay? So just get it clear in your head. Active, passive, resistant mobility, special test, palpation, and then other tests. Active, passive, resistant mobility, special tests, additional tests, palpation, okay? Special tests and palpation are confirmation. I think it's this. Now I either have a special test to confirm it, or I need to palpate to confirm it, okay? To fit into a cluster, okay? Active, passive, resistant. Next thing we're gonna do, joint mobility, okay? So we're gonna do a medial glide, we're gonna do a lateral glide, and we're gonna do a distraction, okay? Typical what we do with most joints, okay? So I need a pair of gloves now.
Right behind you.
Larges? Oh, large. Yep.
Any size you need, doctor.
Not
Any size, but not
Except for
extra
medium.
large.
Yeah, there's no mediums.
There's medium someplace.
We actually did.
It's not that big of a deal.
We actually did.
Use a large.
We'll survive with the
No,
light.
those are large.
There's
So we
always a
have
large
extra
deficit.
For the first
Now the
time
medium people can learn our plight.
You got it for the first time forever, dude.
It was nice for you.
For his birthday, just buy me latex gloves.
Lay down.
Oh yeah.
Yeah.
Okay, so we're gonna do a lateral glide
Yes, doctor.
of the mandible, okay? So we are gonna be inside the mouth. We are gonna be medial to the teeth, and we're gonna be on the gum line. We're not gonna be on the teeth, okay? Because if you're on the teeth, somebody has a crown, and you push too hard, pop goes the crown, and that's a lot of money, right? So you wanna be down on the gum line over the bone, okay? Don't touch people's hair and stick your gloves in their mouth, okay? I'm just gonna have this nice little towel.
Just washed my hair.
It's like a
Okay,
spa.
good. Still been walking in the environment, your hair picks up all the environment stuff. Okay, you're really not gonna be able to see anything with that, but that's
Oh.
okay, okay.
I guess you gotta go.
All right, So Nicole,
You can do it, Veronica.
Hey, yo.
I'm gonna go inside your mouth.
Can you get a flashlight?
I'm gonna go on the inside of your teeth down in your gum line, and I'm gonna try to glide your joint laterally that way.
Okay.
Okay? You have,
Well, you're not gonna be able to see anything.
hold up one finger if it's painful, 2 fingers if you need me to get out of your mouth.
Okay.
Okay? Good?
I won't
So if
bite you, I
do-
promise.
No, but if you gag, I puke. So,
Oh.
okay?
My God.
I won't get. I
Two
won't.
fingers. So,
directly over you.
Don't puke on me.
Yeah. Right? So 1 is pain,
Open container.
2
get
is out.
Okay.
So when you're in people's mouths, you just don't know
Oh, 2 means
how
to take
to
your hands out.
get your hand out of there. Okay? So I'm gonna go ahead and put it here. Okay? You okay?
Mm-hmm.
Okay. The finger is on the joint here. Okay, you relax. Try to relax as much as you can. And then I'm just going to slide her mandible to the left. So I'm doing a lateral glide on the left TMJ. See it?
And you're stabilizing with your left hand.
This is just palpating. Stabilizing the head and palpating the joint. So I'm here. Right, can you get a skull with teeth from the library?
Is this the only way we can do
This is,
Oh, like medial?
well, how else would you do a lateral
Okay,
glide?
okay, lateral, but then
you show 'em.
for the medial, we could do it from the outside?
Yep.
Okay.
You gotta get in there, Leo.
You gotta get in
You don't have a
there.
choice.
Okay? So I'm below the teeth. I'm on the gum line. And I'm doing a lateral glide.
Yep.
So I'm doing a lateral glide of the left TMJ. Okay? Okay?
And
So I'm as back as far as I can get. You relax. And then I'm just gonna glide it. See it? Okay? Does that reproduce any of your symptoms?
No.
Okay, normal mobility, capsular and feel.
I have a weird question.
Capsular infield.
So,
That is shocking, Ethan.
yes. So when you move the jaw on one side, since you said it was bilateral, right?
Mhm.
Is it more of a shift both sides, or is it more of a?
So the right side is doing a medial glide,
This.
the left side is doing a lateral glide.
Okay, so they
right, but
move
I am
together.
not assessing the medial glide
Yep. Just for now.
because I'm going to do my own medial glide on this
Okay,
side.
eventually.
Okay, so you can't assess the medial glide just by saying, oh, this is limited, so it could be a medial glide on that side. Just a lateral glide on the side that I'm testing. Make sense?
Mm-hmm.
But being mindful that a medial glide is happening on the contralateral side. Make sense?
Mm-hmm.
Okay. So next thing we're gonna do is distraction. My thumb now is gonna be on the top of the molars, and I'm gonna have a force that's down towards her feet. So I'm trying to distract the TM joint. Okay. So I'm gonna come on top. Same thing. One if it's painful. 2 if you need me to get out. Okay. And you relax now. Relax. Relax your jaw. Pretend you're dead. Okay. Okay. So now I'm way back on her top molars or bottom molars, all the way back, and I'm just doing a little glide. See that?
Mm-hmm.
So I'm palpating the mandible, and I'm just palpating for a little distraction.
So it's thumb across the top of the
Yep,
molars,
just
and
like
then
that.
your other fingers are kind of curl around the bottom of your jaw.
Can we have that? You dislocated it already?
Yep.
I could tell Nicole's like
It only took him
trying to
about
bite you.
1.5 seconds.
Okay.
I'm trying my best.
The guy's a strong bite.
Okay. So if
He
I'm
bites.
here,
He really bites.
my finger is inside.
Wait, can you
On the, yeah.
You want me to hold it open?
I'll be like it.
Not on the teeth, okay.
Not on the teeth.
Straight down.
Leo,
on
where
the
am
teeth.
I?
You're
On the gum line, on the
gum
bone,
line,
not on the teeth.
in their gum line.
Because if somebody has crowns, you'll knock them right off.
Okay.
And somebody has a $2,000 crown and you pull it out, they're not going to be happy. Okay? A crown?
Like put on the tooth, covers the tooth.
So when you have bad cavities and they have to replace the tooth. Okay? So a crown is a replacement of the tooth. The bone and the root is still there, and then you have a nice cap on top of it. Okay? And they cost about anywhere between $2,000 and $2,500 a piece.
This where you're talking about your hand placement, this is for the lateral glide, not
Correct.
for the distraction, right?
Correct. Lateral glide. Here's my finger. I'm inside the mouth. I just dislocated the jaw.
You need help to hold it open?
No, I got it.
Well,
Just gotta find it.
it's stretchy, like very nice spring.
It came off.
Okay? So right there.
Seasoned
So that's the lateral. Distractions right here.
Okay, got it.
Oh.
Distraction.
So we can put it on just for distractions.
Distractions on the top. Lateral glide is on the inside, on the gum line, on the bone.
And you won't mess with their crown
And you're
like that,
pushing-
because it's a normal shoe motion.
Correct.
You're pushing towards the midline.
For which one?
Like for the left
Too many
side,
conversations. You guys,
For a left lateral
this is
glide,
hard enough. Go
Like for a left lateral glide, we would be bringing the jaw away from the left side.
this way. Lateral.
Oh,
Lateral.
Away from bed. Push it.
yeah, push it. Okay, push it.
Okay. But I'd be inside the mouth. Yep.
That's lateral guard.
Yep. Okay, so the condyle is moving laterally. Okay. Distraction. I'm over the teeth. Here. And I'm doing a distraction.
Do you do
Okay.
bilateral? So
No.
both sides of
No.
your.
No, because you have.
No. Never.
No, one.
One side.
Okay.
One side. Never bilateral.
Never bilateral.
Never bilateral.
For dash,
Never
If you're not
bilateral.
doing both sides, you're doing both sides. What I mean.
Would you do both? Would you do UPAs bilaterally?
But this is also the only bilateral fin movement.
Right.
That's why it's
So
fine.
that's why I gotta assess the other joint specifically. Make sense?
What was the positioning of your other hand?
I'll show you again.
You're palpating the joint.
Yeah.
Okay.
Yep.
You're holding the other side and you're just making sure it's stable. So imagine you pushing your head turned. Yeah. Moist hand. Good enough.
whenever she gets out the shower.
That's Maddie's way.
She did a flip and a twirl.
She has.
You won't find gloves and powder anymore.
I was supposed to tell them.
Like it looks
Strawberry flavor.
Microfiber.
Okay. Ready?
Oh, yeah.
One finger for pain, two out.
Got
Okay,
it.
so lateral glide. I'm palpating the condyle.
Okay.
I'm coming inner mouth as far posterior as I can, underneath the gum line. Okay? And then I'm just gonna do, so this hand is counter force plus palpating. Okay, so that's a lateral glide. Okay? You okay? Okay. Distraction, relax your jaw.
Number one is pain.
So distraction is I'm going right down towards your feet. So I'm causing a separation. What's the definition of a distraction? A force that's
Directly
perpendicular to the
joint
joint.
line.
Right. So I'm doing that. Okay? Does that reproduce your symptoms?
No.
Okay. Good?
Yeah.
Right? And then medial glide. You're going to palpate the head, palpate the lateral joint line, and then I'm just going to do a medial glide here. Very little room between the condyle and the lateral pterygoid plate. Minimal room.
So for the medial glide, you don't go inside? Okay. Can you redo that one?
Yep.
Sorry.
So I'm going to come on the jaw. This is my mobilizing finger. This is stabilizing. And I'm just doing a medial directed force right over the joint.
Okay.
Okay? And I'm looking for reproduction of symptoms.
Are you pushing here?
Pushing right on the condyle.
Okay.
Because I'm trying to glide the condyle medially. Okay?
Okay.
Good. Yeah, change my gloves again. Okay, so right here.
Cole's fine with it.
Yeah, I'm fine with it. Just throw it in there. It's good for
Okay.
the immune system, don't worry.
Got it.
Builds
So my
character.
hands here. Hands here.
If you
I did
can't
that.
picture it, grab the model. Whenever you're practicing cervical spine, lumbar spine, grab the model.
Okay? So distraction, lateral glide, medial glide. Those are the only three. Good? Let me do your